Before we had robotics, for cervical dysplasia or cervical cancer, if someone needed a hysterectomy, this was usually done either with an abdominal or a vaginal approach. And the decision for that was made upon a number of factors: patient weight, previous operations, whether they'd had children or not. Certainly some patients are still candidates for vaginal surgery, and vaginal surgery, when safely performed, has comparable outcomes to robotic surgery. The problem is not everyone's a candidate for a vaginal surgery. And especially for cervical cancer, there's no safe technique that surgeons feel comfortable with for doing vaginal surgery for cervical cancer, for pre-cancer certainly. There's a laparoscopic assisted vaginal hysterectomy, and certainly that was one of the ways to perform minimally invasive surgery before the technology had kind of reached further. The standard complete vaginal hysterectomy, everything's done from below without any incisions on the abdomen. But the problem with that is it's very challenging. One, you don't get a full evaluation of the abdominal cavity, especially for cancer surgery. A lot of what we do is just looking through the abdominal cavity to make sure there's not cancer cells somewhere that we haven't seen. It's much harder to see also the tubes and ovaries from a vaginal hysterectomy. So people then move to the step of doing laparoscopy with vaginal surgery. And the laparoscopic incisions are very comparable to the robotic incisions. I would consider the incisions to be essentially the same. What the robot really is just a tool for performing laparoscopic surgery. It's still a laparoscopic procedure. The robot is just a far and away improved technologic approach to performing laparoscopic surgery.